topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Are you ready to take a journey? Let's connect with the healers of the world. It's that time. It's time for the Language of Healing on W4CY Radio and Talk4 TV. Now here's your host, Emotional Wisdom Training Specialist, Nicole Fortin.
Hello, hello, everybody. Welcome to the Language of Healing. Happy Friday. How has your week been so far? Having a good transition into summer. I know there's a lot of stuff going on, in the world and maybe personally and seasonally. Things are changing and constantly moving. And as for me, I've had an interesting week. I've in the middle of moving and maintaining, life, home things, work things, some fun and playtime, trying to keep the balance of everything. One thing about me is I do live a very full life and I've done a lot of things and I'm very interested in a broad range of topics and activities. And I like to really try it all out, see what really fits and what really juices me. Because I think that's really important in life is to follow your passions and be led and guided into, things that really nourish your mind and your body and your spirit. And so today, we're going to talk a little bit about my journey, which is something, to be quite honest, that it's not that I necessarily shy away from sharing all of the things, but that feeling when, is it bragging or is it being confident? There's that fine line. I don't know if you can relate to that, when you have something really exciting that you're passionate about and it's kind of consumes your world, right? It's like, when's the point when you're talking too much about it or not enough? And I realized that there are so many facets of the work that I do that, within a short time, it's hard to really get a full spectrum of where I'm coming from. And that's part of the reason why I've started this radio TV podcast, so I could shed some light on the things I've encountered or the people I've met that have really expanded my perspectives and my point of view around the world and healing and the body and what that all is about. So every week we have 50 minutes together and we get to see a little snapshot of what's going on around the world and with the healers of the world. And I have been known to be one of a traveling gypsy healer. I've called myself in the past, free spirit, traveling lots of ancient places, seeking traditional knowledge and healing methods from around the world and studying with those masters or teachers that are still practicing these things. So to dig in a little bit more, I've brought my good friend and colleague, Dr. Stephanie Yip, on today to interview me or ask me some questions, or you'll hear some of our dialogue in our conversation. So let's welcome Stephanie to the show. Hi.
Hi. How are you?
Oh, I'm good. Thank you.
Happy belated.
Oh, yes. Thank you. I also had a birthday this week. It's, 34. Is that like really exciting? I don't know.
Gearing up for the midlife.
Midlife. Yeah. It's like a nearly an eighth of a century. Oh, that's probably bad math. A third. Yeah. Yeah.
We're lucky.
Yeah.
So we're talking about you.
Right.
Yay.
What do you got? What have you got for me?
We'll start with the cliche. What made you want to get into medicine, healing?
Oh,
What steered you towards wanting to know about the body and be hands-on and serve people that way?
Yeah, there's so many little trails that I can see that led me to where I'm at today. I was really always into sports, and I had actually a bit of an injury in my low back when I was 17, just playing excessive amounts of sports, and you're a student, you're sitting down all day, but you have that activity and you're young, but you can still get injured. So I started going to see a chiropractor and massage therapist, and I just found it really helped me. And I was really into sports medicine, like healing and, injury recovery.
Mm-hmm.
And I really knew the one thing I knew that I didn't want to do was sit at a desk.
Yeah.
Day for my job. And so it was like, what can I do that's active and engaging and working with some injuries?
Yeah. Did you ever want to go down the chiropractor route?
Oh, I looked into that because I looked into chiro and versus osteopath because they have the same branch. They're off of the same branch, just like a little bit different technique style.
Mm-hmm.
I didn't ironically, I love traveling, but I never wanted to travel far for school.
That's funny.
Isn't it?
Me too.
Yeah.
It's like, because there's no chiro school here.
That's right.
Yeah.
And the best ones, are in the US. And there's maybe those extra steps of really committing to that.
Not to knock chiros, but I'm kind of glad because I wouldn't want to be a chiropractor. Now that we're Chinese medicine doctors, it's like I would have felt so limited, perhaps. Maybe not, but
yeah, I mean, I see that too. When they study, it's really specialized in the bones and the skeletal structure, right? And it's obviously more than that. Like you're dealing with the nerves and the whole body system, but you see a lot of them add on, soft tissue, techniques like active release therapy or Graston technique, and to work that soft tissue in combination with the bones. But I'm also like really happy that I went with Chinese medicine because I looked at naturopath as well.
Right.
And they study a bit of that, like, holistic, well-rounded, like allopathic type things, but with Chinese medicine. But again, it was like, okay, there's only one school, like, got to go to Toronto. And
so you started, so you're out of high school, you're deciding what you want to do, and you enter massage right away? Or did you take a year off?
No, right away.
Right into massage?
Freshie, 18 years old.
18 years old.
2 months after high school.
How long did you do that for until you wanted to add on to it or broaden your scope?
It was a pretty it was a 6-month course, intro, first year, 6 months. So I knew, okay, if I get into this, like it's at least opens a door into something this alley that I might be interested in. I'll see if I even like touching people, or like working, because that's a big thing, right? Like you have to kind of be okay with that. Yeah. I really enjoyed it, kind of being a keener, studying the body and the inner workings of it. It was a lot more intense than anticipated. Well, I had no idea really. Right. But then we had the option to study a second year, like another 7 months.
Right. So, and get the increased hours.
Yeah, increased hours. And the first day of that class, I was like, whoa, how could anyone not keep going with this? Because there's, we really treat a lot of things, getting into pathologies and how to, how to recognize when someone's really not well, like when to refer out, how to properly treat somebody. These were things that only came as we got deeper. And I don't know, it just blossomed my whole passion for healing, really. It's like an amazing process.
Learn. Yeah.
Yeah. And
Mhm.
then, you know, obviously thinking about the physicalness of it, like I'm 18, 19,
Right.
and what's the longevity of massage, really? Can I work till I'm like 65,
Right.
70 with that?
Definitely.
And
Shelf life.
right, I think the average massage therapist career span is like 10 years. So,
Right.
I mean, but I do know some people who are 25 years in the business. Amazing, amazing. But you're always learning and adding on new modalities, new techniques. And so it just was natural to keep going
Mhm.
into like, oh, what else could be going on? You know, I just found like people would have the same things repeating, coming back. And it's like, okay, well,
Right.
what's deeper? What's like more at the core of this?
Right.
What is really,
So
yeah.
what led you to Chinese medicine? Like, how did you discover that?
That was in some additional training for massage. We were doing visceral manipulation. So
Okay.
learning how to work the stomach and the intestines and like, you know, draining the liver, you
Yeah.
know, like these kinds of things. And then our teacher was amazing. She had this chart. Um, and visceral manipulation is a very subtle technique. Like you have to have like patience and kind of this like general stillness to really feel what's going on, or like the patterns that are, or the
Right.
motion of it. So I liked that took me a bit deeper with it. And anyway,
Mhm.
she had this chart that was like all the organs and then associated season, color, taste, smell, you
Okay.
know,
So some TCM.
TCM. And then there was a column for emotions. And I just like that really blew my mind that our organs are connected to like our body holds
Was that your
emotions.
first exposure to like that mindset or that I don't even know
Yeah.
if they way of looking at the body because it's such a truth. But like really connecting mind body and the patterns, was that like your first
Yeah.
discovery of that?
It was also probably my first intro into Chinese medicine. Like, I don't
I
even know
love
if
it.
I had ever heard that acupuncture was a thing. And I mean,
Yeah.
it's like 5,000 years old now that we know. It's like, how have I never actually heard about this? But it wasn't in the culture. Like, it wasn't something that I grew up with. I
Nope.
think I always knew that there was, you know what I remember most though, even as a kid, is like I loved playing with herbs. Like I would go and like pick dandelions and I would take the rainwater. Like after it rained was most exciting time for me because my like wheelbarrow would be like full of water and I could go pick grass and dandelions and make soup. Like that was my that was like my playtime as a kid. And so it's
Yep.
funny that I do Chinese medicine now, like,
Dandelion root tea.
right? It's like my
Very.
inner 6-year-old knew
Okay,
that.
so you're taking this course, and then from
Yeah.
there, were you like, that's it, I'm doing TCM, I need to, or did you need to know more about it? Like, what was your next step? How did you find, because me and you went to the same college, that's how we met. So we started same year, took the bus together. So like, what made you take that next step to like actually enroll and find TCMA, which is our college in Calgary,
Yeah.
Alberta?
Right. Well, okay. So like we said, like it was close, you know, I could ride my bike to work or take the bus, like, you know, on the 10 months out of the year that you can't really ride a bike here in
Yeah.
Calgary. But yeah, I got in, yeah, right away. I think I worked for a couple months
Okay, so it's
and
quick. You like learned about it and you're like, I'm doing this.
yeah.
I
Yeah.
love that.
Yeah, I just knew I needed to go deeper, like just a super keener for more,
Right.
more information, like study more.
Student for life. I feel like, at least 3 of us were like that, in our class. We just loved the whole process of learning and being like just so deep in the content. And it was just like the theory was like my favorite part.
Yeah, because I think even at the end of the day, if like you don't practice it, that knowledge base is hugely valuable to your life.
Oh yeah.
Right?
Yeah.
Like
huge.
just being able to,
Mhm.
I don't know, make those kinds of connections that in a more natural way.
Yeah.
Like I really like having, because there's a lot of, I mean, I'm sure you see this, you know, when we're working with people, and there's a lot of precursors to illness that don't get caught otherwise, right?
Yeah.
Unless it shows up in your blood work, unless you have that symptom or that, you know, physical manifestation, there's not really much that's
Right.
available to you, right? And you know, it's like even the concept of chi, you know, chi is like material, solid, and immaterial, like vapor. So there's
Right.
like things, you know, illness is either like vaporous or it's solid and dense. And I just, you know, think like by the time it gets to that solid, dense part, that's like the tension, you know, that one spot that I want the deep tissue. But like, what about, you know, the other stuff
100%.
that kind of locked it in there? So
Yeah. It's like, I mean, and that's often where, unfortunately, still in our culture, where like the learning and educating the masses is sort of our job right now, being like a forefront of this medicine in this culture. Obviously, it's not the case in Asia, but it's, you know, preventing these things from getting to the point where you can see it on a test. Like, how many
right.
patients have you had that say, oh, I've had horrible acid reflux for 10 years and I'm on this prescription antacid, had an endoscopy and all these other tests, and the doctor says I'm fine. And we say, okay, well, did your doctor discuss diet with you? No, nothing. But there's nothing, I'm fine, there's nothing to see, I just need to take an antacid. But we know, like, there's an underlying condition that's causing this, and it's going to eventually cause all of these other things. And then you'll see it on your test, but by that time, it's really difficult to treat.
Yeah, it's like, so it's more solidified, right? Like,
right. But anyways, okay, let's connect to you.
No. I love this because, yeah, like what I loved about Chinese medicine too is, you know, traditionally the doctors used to get paid for not having clients, like for not having patients. It's like all your patients are healthy. You're doing a good job.
Right.
You know?
Yeah, that makes sense.
Yeah.
Yeah. So, okay,
It's like a totally different, you know, mentality. And I liked that it was like a different perspective. Yeah.
It made sense. And once, I don't, like, speaking for myself, when we were learning all of these things, it was like a brain explosion, like you said, making all of these connections that you would assume would be common sense, but they're not when you don't grow up that way.
Yeah.
It's like, oh, maybe I should be pooping every day. That's
oh my God, that's totally, like, totally, you know, personal. But one of my things, like my body conditions, was having constipation, you know, and acne. So, you know, in Chinese medicine,
oh, my periods would be so debilitatingly horrible that I need to take Advil and Tylenol the day before just to manage it. That was my doctor's advice. You just need to take an Advil the day before. Or birth, like that. Right. Otherwise, you're fine. There's nothing wrong with you. Like, I know you cry in the bathtub day 1, day 2, day 3, but
but that's perfectly normal.
Perfectly normal.
Yeah. Yeah. So I know we feel a lot like, you know, we have the similar values and philosophies when it comes to treating the body, but because we have that background, and Chinese medicine offered it. I also went then, so I started, we started together in first year, and then I also had not doubt, but curiosity as to, is this the medicine channel that I really want to go down?
Okay.
And with that, then I went to India for, you know, I took off, like, went to India and Indonesia, and I studied
for a year, and then you weren't in my class anymore.
I know, I was like kind of that part-time straggler afterwards, you know.
So, okay, what was your motivation to go to India? I mean, so for a little bit of background, we were in year 1 and it was awesome. We loved it. And then Nicole decided she was going to India. It was year 2, right? The start of year 2?
Yeah.
Yeah. So she took, and we had like the best class in the world. There was like 5 of us. So it was a pretty big sacrifice to just pick up and help that and go, but you felt you needed to do it. So what sort of drove you to that?
I was still really interested in like traditional healing methods, viewing the body, but so I wanted to check out what yoga or Ayurveda had to offer.
Right.
Really, so I stayed in an ashram, which is, kind of like a monastery or communal living space where we studied yoga. We'd get up at, 5 in the morning and do your asana, do your meditations, do your chanting, do your chores, your silence, all the things, right? And learning about Ayurveda as a medicine, which I really love, but the tool of acupuncture really drew me back to Chinese medicine.
So after like being in India and learning these other things, like it like made you want to do acupuncture more?
Totally. Yeah.
Oh, cool.
Yeah. So it wasn't like, well, maybe like a little doubt, but I don't know if that was the word. It was more
reaffirming your decision.
Yeah.
I mean, there was other things going on in your life. I think you needed to just get away and rediscover yourself. So we'll get into all that stuff. But being in India, like what other, now, was it like that yoga cult that Netflix did a series on? Did you join that?
Oh, wow. No. It was definitely not, but it was pretty rustic. I will say that. It was, well, where do I even begin? I mean, India was a wonderful 360 experience.
And you were there for how long?
India, 2 months. 2 months.
Yeah.
Yeah.
And then
Indonesia. Right. Yeah, Indonesia, where I spent 3 months working at a birthing center, but run by midwives.
Yeah.
And they had, so in Indonesia and like many other places in the world, you have to pay to have a baby, go to the hospital and have a baby, and there a lot of poverty there. And so women will keep getting pregnant, but not have money to go deliver babies. And there's this really amazing woman, Robin Lim from the US, who started this foundation there to give the women a space to come in and deliver their baby with midwives. And then they had the Chinese medicine doctors treating like postnatal care, pediatric care, and we would do a general public clinic once a week.
Yeah.
So, I got right back into Chinese medicine, like even away, so that was a really cool experience. And I think it solidified my love for it, because you would see how it could help, like a woman hemorrhaging after pregnancy and just a few needles, bam, 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 and like stop the bleeding, and like support mother and baby. And yeah.
Amazing.
I know. It was really cool. So then I came back really excited. I mean, not that I wasn't excited already. It's like excitement drives most of my decisions, like and I think that's what I follow, like what juices me up, really. Yeah.
What sparks that interest and that desire to like put yourself into some more content and Okay, so you come back and we finish our 4 years. And now you're a working acupuncturist.
Yeah. Well, I went to China too to do my practicum.
Yeah.
And working in the hospital was a really interesting experience. Just being in China was amazing. Right. I really loved it because it was I'm so fascinated with it, like so curious to know more. And yeah, like their culture, I mean, they do know Chinese medicine. They use the food as medicine.
Right.
They're when women are menstruating, they know how to like the do's and don'ts, right? Because it's either good, supportive, or damaging to their body, where we don't really have that ingrained in us here. Like we just think, I'm menstruating, I'm gonna go play, like I'm gonna go, I don't know, run a marathon or something like that, you know.
Or eat shitty food because I need
eat ice cream,
gratification. I need the chocolate because I'm feeling, estrogen's low, and that gives you that little serotonin pop. So you eat the sweets, and then you get all inflamed, and and I know we don't really, like, it's not cultural, so our mothers aren't teaching us that. Hopefully we're teaching our daughters to like break the cycle, right? And get that's something I really love about Chinese medicine and the Chinese culture is food is medicine for them. Like, you're sick, okay, you're gonna eat this soup with specific herbs in it. We're gonna switch to kanji. Like, everything they do is taking that into consideration. How's this going to nourish my body? Like you said, is it supportive or is it depletive for me? Like, it's so different here. We don't think that way. It's just sort of, nobody really knows what to do, I think.
Yeah, but but then there's some like the old, like, old farmers and stuff who eat, like, the organ meats, and
That's
they make
true,
they make their blood pudding, and
it's so few and far between, though.
Yeah, I know. It's like it's almost like a cultural, well, it's how we've survived, straight up, right? And we can't like discredit all of what's built us as humanity, really. Just like just forget it. Like, also when an example of botany, right? When I'm thinking of the Kew Gardens in London, that were some of the base roots of where botany came from, exploring different lands, collecting plants, and making a library out of them. I mean, they look cool, like, the flora of the world is really quite interesting, and its geographical significance. But, and then studying how those plants, like what they do on a chemical level to help support our body, bringing the science into it. But now, in pharmacology, you don't really study the botany. You don't study where this came from. So there's like that gap of, it's like honoring the tradition. I think there's some merit to that.
I think the mindset, and this is where like we need to shift and sort of take note of these other cultures, and cultures that are older than us, is the mindset right now is survival. It's not like longevity and quality of life. It's like, just get through your day with the minimal amount of pain you can manage, because that's exactly what our Western medicine is. It's symptomatic. So it's not, okay, let's correct this issue so you have longevity, and then it's going to take a while, but then you're not going to have this pain anymore. It's, let's just manage the pain so you can get through the day. And if you can't sleep, we'll manage that with some more. And if you can't wake up, we'll manage that with some more. It's like, just, that's sort of how we've just developed, because that's the culture. It's not about, it's like everything's quick, you must be productive, you must be busy, and it's got to happen now, or you're lesser than. And unfortunately, our health seems to be in that realm as well, instead of slow and quality.
Because we don't notice it, right? It's like the slow progression that eventually sneaks up on us. So we can maintain, we can live in very high stressful situations for quite some time, but eventually that wears the body down.
We can, but it doesn't mean we should.
Totally. I've really noticed that the last year. I mean, the whole pandemic thing, it was like, the world is on alert. Okay, we have this pandemic. Everybody do their best, stay home, quarantine, just like be safe, stick to your bubbles, wash your hands, all that stuff. We'll try this for a couple weeks, and then we can relax, like once we know more, we can relax, but we haven't really actually relaxed. And just a little malfunction here.
Yeah, I know. I think it's been, if anything, it's highlighted what's wrong. I don't know that a lot of people are seeing that because we're only really, mainstream media, we're only really given certain information, but like no one's really discussing the immune system and how to regulate it and why it's so important to have a strong immune system. You know, where a lot of these high numbers of mortality due to COVID is happening, and like what the communities are like. You know, how are their diets, and are they active, and are they getting enough nutrients and all of these things, and stress levels and access to everything, right? Like that's not really discussed. It's more so, again, vaccine, get the vaccine as quick as you can, get, you know, like shut yourself off, wear a mask, but it's never like get your vitamin D, eat well, promote your immunity, practice mindfulness to lower your stress, and you know, manage your difficult emotions and stuff. It's not discussed here anyways.
Mm-hmm.
It's like not even ever mentioned when you hear the news. It's so strange. It's so weird.
I know that kind of, you know, I noticed that too, because where's the attention on the patient care, or like your cultivation of true health and vitality and true immunity and true like strength, you know, of the body and of the mind. And I mean, we see this like the will, you know, the will to do something, like the will to live, the will to die. It makes such a difference in how our physical body is responding. Yeah, I thought of a couple things there. There's so many tangents, but this is also why I studied then, you know, went further into the emotions and how to master our emotions.
Okay,
And
so you're in China. Hold on.
Yeah. Okay.
You've studied in China and you traveled around Asia for a while, right? Like, so you do the 6-week practicum in China with our school. And then from there, where did you go? What did you do?
Oh, well, I was with another great colleague and her now husband.
Yeah.
And we did from Beijing to Lhasa, Tibet.
So cool.
You know, I know. It was amazing. On various buses and trains and yeah, and then we got into Tibet, and that was quite a cool experience, you know.
Yeah, immersed yourself.
Yes. Immersed myself. Ate delicious yak momos. they're like a little dumpling. Well, you know, a dumpling, but made with yak, and they have. Yeah. This is one of my favorites. And the buttermilk. They drink the buttermilk. You know, like just looking at health in their how they've adapted to living in that high altitude. Like they say, if you don't live there, you cannot conceive there. Like the body doesn't know how to. I don't know if that's true or not.
Acclimatize and eat the food and do all the things in order to maintain, to live.
Yeah.
So yes, it's so interesting. So how long did you stay overseas for?
That was I've been back and forth many times, but I think that trip was 6 months. That China trip.
Okay.
And then because then I went to Nepal, and I stayed there. I was going to do the Acupuncture Without Borders.
Yeah.
Yeah.
I'd still like to do that.
I know. It would be really great. And I know that in some of these places, access to medicine is really difficult. And so you're there, you know, just, I don't know, they're a lot more open to treating it from a natural perspective, right? Like they understand that the climate affects them, and yeah.
And they, like you said, their access is so limited. So when opportunity comes, they grab it. I've heard a lot of people talk about their experience, how great it was, because you get to see the medicine the way it's meant to be. Like in North America, people can't come every single day. You know, they're time poor. It's obviously not affordable. But there, you know, you get the same patient coming every single day. You do your balance method or whatever, your few auricular points, hand points, and you can see them get better. You can see things resolve. Where here, we're lucky if our patients are going to come consistently twice a week. That's very lucky. Otherwise, it's usually once a week. So things take a lot longer to heal. And you don't get to see the medicine, I think, the way it was meant to be, which was like daily. You know, something daily for 2 weeks or daily for a week, and drink these herbs every single day, and you're better.
Yeah, in China they have it running so nicely. Like you stay in the hospital if you have a stroke or you're trying, even like the infertility clinic, you know, the women would stay there. Like they would get treatment, and I know it's not just women, you know, there's obviously like the male part of infertility, but the hospital makes their herbal formulas for them. They have a whole department that's just like you bring your prescription, they cook them and prepare them and package them, so it's really easy to take. You just go pick them up and you have your week's doses. And but like stroke, you know, if you have a stroke, they're just staying in the hospital, and every couple days they're getting acupuncture, and you can see the progressive change in how they're really improving. Like it really is amazing, you know, how they have it set up. I like, it would be nice to have that here. I just don't know.
Integration is beautiful, and it doesn't take away from Western medicine. I always tell my patients this, like, you still need to go see your doctor to get your tests done. You still, you know, if you're having a stroke, I prefer you go to the hospital. Don't come to my clinic. And if you broke your leg, if you're having a heart attack, if you have cancer, like, but then combined with TCM, it's amazing. It's perfect.
I mean, the head of the cardiology department, he was, well, all the doctors mainly are trained in both Eastern and Western medicine.
Yeah.
If you're TCM, we have a comment. It's almost as if we don't put priority on our health here until something goes wrong. We're often in reactive mode. Totally.
Always reactive. Yeah.
It's like, wait till there's a big problem and then
and then we can do something. Broken, then you fix it instead of like maintaining your vehicle. Just gonna wait till it completely breaks down. Then you're, maybe I should change the oil and fill the gas tank up and, you know, rotate the tires and all that stuff. Very reactive. Yeah. It's super unfortunate. Right. But you're saying like all of our professors and teachers who were from China originally had both. They had a Western, they either had an MD, like a general medicine degree, and then they usually would have a specialty. Like Dr. Lee had a master's in cardiovascular health, master's. She was amazing.
Yeah. So they'll go, like, they'll check the pulse, you know, like they'll do TCM diagnosis, which is checking pulse and tongue and, you know, our pattern differentiation, like through questions or whatever that you're picking up. But then, you know, like they're also on like the heart medication because they've just had a heart attack or like, you know, something like this, but they really blend it together and they know how to work them. And I think it's just needs more information. Like Chinese medicine, it's a different language, honestly. It's really, I mean, it's Chinese, but it's also like Chinese medicine is a whole different perspective. So when we're categorizing herbs or treatments, they're classified differently and than the Western medicine, and there's that gap missing. So if we look at like, I can't think of one right now, vervain or valerian, something like that, I think is maybe more commonly like mixed together, or, you know, there's, I don't know where I'm going with this, but well, I do, but that's where the gap is between the two, is like they're both saying the same thing. They're both doing the same thing. They're both like full body
inflammation, one saying heat.
Yeah, exactly.
Yeah. Okay, so you're in China now, or in Asia for about 6 months. Now you come home and you're practicing. What now started your journey and led you to NLP or emotional wisdom technique, and more focusing on really like helping people deal with difficult emotions and manage that part of it? Like what's kind of brought you to that end of health and wellness?
A couple amazing people in my life that were like these anchor points. Like when we were in school together, I called him my life guru. So, you know, a coach, a mentor. We worked a lot together, and he introduced me. I remember it was like around this time, around my birthday, and I was in China. We were going to Zhangjiajie, which is like the Banff of China, where they filmed Avatar. So those like big pillar mountains. It was amazing. And I'm like sitting on this like really rustic bus, you know, and I like just a bumpy ride, crowded, and I got an email from my life guru, and he's like, there's a position open at this clinic that I think you should, you know, contact them and see if it would be something that would fit with you. And I'm like, oh yeah, sounds great. I'll be back in a couple months, you know?
Yeah.
But then I did come back and I contacted them. I started working with them, and they're a beautiful family that have owned a clinic in Calgary for 25 years, Lynn and Carrie Hilderman. And Lynn is an incredible woman who's delved into so many techniques, and she's always I really connected with her because she was wise. Like there was something really even and real about her that I could, you know, you just feel like you talk about anything with, you know, like those people that you're like, I don't know why I'm telling you all of my life's problems, but I am. And this you know, and so you know, she could support me in that, and through that she started coaching me as she was going through this emotional wisdom training program. So I was a guinea pig, I would say, for a couple of years of doing this kind of training.
Learn this,
and we would meet once a week on the phone, and she would ask me questions, and I thought they were awesome. I'm like, why hasn't anyone ever asked me this before? Or why haven't I ever thought about that? And it really opened up so much, like just more curiosity. I don't know. I'm a total like inquisitive person, very curious. And then when I shifted the focus onto myself, you know, more curious about me, what I am, what I'm doing,
how you operate, why you make these decisions.
Yeah. But really what got me into it was a difficult relationship where I had to make a choice. Do I stay or do I go?
Yeah.
And sifting through that with the layers of old patterns, emotions, like all of that. You know, I really needed some support in sifting through. So I'd started working more with Kate Michaels, and so she trained me. I've been doing that since 2013, actually, almost.
What's it called? Like, what were you trained in precisely?
Emotional wisdom training.
Emotional wisdom training.
Yeah. And along that, there's core alignment coaching, which is a bit, you know, it's a bit of an umbrella, you know, and then that's also using techniques from Neuro-Linguistic programming and cognitive behavioral therapy. So it's using language, you know, hearing what someone's saying, and then you know, kind of reading between the lines too, or gathering more information around that.
Right.
You know, so.
And how do you feel that can help somebody in, like, I know we've done a few together, and it's been interesting and eye-opening, and there's this like block for some reason, I think even for me, where I don't quite understand it, and then all of a sudden we're going through it and you're like, whoa. Like we did the one module where we're coming up with some mantras or keywords or things to sort of I don't know, you would describe it more eloquently than me. But at the end of it, we had these 3 things, and I didn't even realize we were developing those 3 things just by our conversation till we got there. And it's just super interesting. Super interesting.
Yeah. Yes, because we're dealing with the conscious, subconscious, and unconscious realm So our conscious body is like, what do they want me to hear? What am I supposed to say? What should I say? And how often do we really live our life like that to fit into society or to fit into these roles that we've kind of developed or taken on?
These thought patterns that are such, like, everything's coming from our, I don't even say rational mind, but it's like, reactive again. We're reacting based on how we were raised and our, behavior that we learned from our mom and dads, or that we inherited ancestrally, or that we've developed through fears and trauma, and we don't know that we're doing it. We're just like, bup, bup, bup. And then you go through these modules with you and you start to realize where those things come from. And it's very similar to therapy, except for me, just in my experience with it, it's a lot more eye-opening. Like you're seeing the development as you go.
Mm-hmm.
Yeah,
definitely. It's like we're not really fixated. I mean, where you've come from, looking back supports where you want to go, right? But we're not looking back to reopen all of the trauma. Like we're looking back to gather the information that's positive and that supports us. Well, that supports us really. And then, finding some acceptance or being able to work with that creates the awakening to change it. But, we often don't see our patterns, like working with Kate when I had that, difficult relationship, and I don't know, I'm confused. I was playing a really passive role. And then through that, I learned about how I am in that passive aggressive relationship dynamic, how I can be passive or aggressive, and I mean, really, she showed me that I've attracted these somewhat abusive relationships, like not physically, but there's just like this level of, it's like wasn't supporting me. So I mean, what difference does it make? It's huge. Like even to just know, I know it sounds, I mean, it sounds easier said than done, right? To stand up for yourself and to, be true to yourself, really find people and a network that supports you, and like how to, to have people to count on, I think.
And that's sort of where your focus is now, is with emotional wisdom training and NLP. Like you're still obviously practicing Chinese medicine, but that's kind of what's your passion is, to really focus and help people through that modality.
Yeah, but I mean, it all ties in together because, like I said, what got me into Chinese medicine was realizing that our emotions can be stored in the body and can lead to illness. And so when we're doing acupuncture, we're still like the diagnosis and treatment principles for Chinese medicine are essential. It's like that's the map of where we're going with this body. But all the techniques and modalities that can help support it, unwind it, clear it, boost it. I mean, it's a tool that I've found very useful because we can be holding a lot of chronic tension and stress in our body that has a root in something emotional or a pattern, like even there's the pattern of posture. If you're continually, sitting hunched over, eventually your stomach isn't going to get like, your diaphragm isn't going to move and your organs aren't going to have free flow. I know, right? And then it just shrinks your confidence. You act small, you play small, but you go in because you have one pain in your back. Yeah. But it's like, well, what else is really, what's holding that? What's holding you back from?
Right. And I mean, in Chinese medicine, we know that it goes both ways. So your physical body can lend to those difficult emotions, meaning if your spleen or your liver, say, is dysfunctioning or low or in a disharmony, it can lead to overthinking, worry, reactiveness, stress, irritability, anger. You're also, if your heart is, if there's like some heart fire or heart Qi deficiency, you perceive information differently. Your intuition isn't as strong or clear, and again, you're reacting perhaps differently than you probably would in a balanced body to outside stimuli. So in Chinese medicine, we can harmonize those organs, but then what happens if there is that pattern? That's where I guess like NLP or emotionalism training is really helpful. So you can break the pattern so it doesn't affect us physically. So it's like you can take care of that physical disharmony and then help them, discover their pattern or change their thought process to a more healthy one. And yeah.
Right. Yeah,
It's
even
like,
if we have the physical like break or something, and now we're frustrated that we have like, a break or an injury when, so that it goes both ways. Yeah, it's really just about like, the perspective, new perspective, staying open to possibility and training our emotions or training to be more responsive, responding more wisely to emotions and life situations versus reacting emotionally. So, okay, our time is up, Stephanie. Thank you so much for joining me today and helping me, just like open and share more about what I'm up to and
great
my
talking
passion
to you.
for this medicine. You too.
Yeah.
I hope you have a great weekend.
I love
And to
you.
the listeners, thanks for tuning in. Hope you have a good weekend too.
Thanks for having me.
Anytime.
Wow, what a show today, and the journey does not stop here. Come travel the world with Nicole every Friday at 1 p.m. Eastern Time as together we become more fluent in the language of healing on W4CY Radio and Talk 4 TV. See you next week.